आलोक जी ईबी में डाल दें, ईबी ओबी में बोले प्लीज ज्वाइन।
ओके मैम, ओके।
हाँ, वो शेयर करना है अभी 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 एक 5 मिनट के बाद जब वो बोलेंगे ना, तब मैं बोलूंगा आपको। ओके, या
Start, Saji and Ganesh, mute yourself.
Ma'am, we are ready to go live on YouTube. We are live
Yes,
now.
please. Sorry.
Okay, sir.
रुचिर मैम, अनम्यूट योरसेल्फ प्लीज।
Okay. So, a very good afternoon to all the respected dignitaries, distinguished faculty members, dear colleagues, nursing professionals, postgraduate students, and participants joining us from across the country. On behalf of Indian Academy of Pediatrics, uh, it is my privilege to extend a warm welcome to each one of you on this inaugural session of Breastfeeding Alliance 2026, a landmark national academic initiative celebrating World Breastfeeding Week 2026. Today marks the beginning of a historic collaboration where four premier national organizations they have come together with one mission, one message, and one scientific voice to promote, protect, and support breastfeeding. It is my privilege to welcome our respected national leaders, the President, Indian Academy of Pediatrics, the President and Secretary of FOXY, the Chairman and Secretary of National Neonatal Forum, President and Secretary of Indian Nursing Council. Your presence symbolizes the strength of this unique national alliance. May I request now Dr. Neelam Mohan, the President IAP, to deliver the welcome speech and formally launch Breastfeeding Alliance 2026. Over to President Dr. Neelam
Dr.
Mohan.
Ruchira, HSG of Indian Academy of Pediatrics. In fact, as a pediatrician, I think what really worries me most is that 1 in every 2 babies in India is still not breastfed within the first hour. And even more concerning has been that the exclusive breastfeeding rate dipped down in the latest NFHS6 data from 63 to 55%. I think this decline shook us all together. What, despite the remarkable achievements of having 95%, 90% institutional deliveries, where are we going wrong? Are the healthcare facilities and healthcare team not able to convey the message to mothers and the families? I appreciate that the preterm children are around 18, the low birth weight in preterms are 18%. But the very fact, the statistics which showed us that if these preterms were given breastfeed, then the incidence of the mortality related to pneumonias was 15 times less. How come we did not convey, or how come, where are we going wrong? Is it, so today, we are confused why this message that breastfeeding is not only nutrition, but it is also a life-saving intervention. If we can say that early breastfeeding and feeding in preterm and sepsis can decrease with effect on the microbiome, all this we are able to say and still not work on it, it speaks that somewhere we all need to participate together. And we need to convey this message to the families and the healthcare system, whether it is an obstetrician, whether a pediatrician, whether a neonatologist, whether a nurse, whether a lactational counselor, whether a public health voice person or a policy maker. All of us need to be together. So, with that vision and dream, I am so very grateful that I think I'm totally blessed as the president of Indian Academy of Pediatrics that when I connected my colleagues, Dr. Lalan Bharti, the president of NNF, who is actually they'll be doing a lot of work with preterms and low birth weight deliveries, and Dr. Bhaskar, president in Foxy, who's got a vision absolutely clear and is actually been working various projects, how they can help to improve breastfeeding. And last but not the least, I'm so grateful to Dilip. Dilip, I just gave you a call and you were there to join us in this forum because it is said that when a mother has a cesarean or the mother thinks her feed is not available, I mean, it is a myth or a fact, we don't know. Is it the gynecologist, is it the pediatrician, or it is the nurse who is suggesting to buy a box? Because somebody yesterday told me, Dr. Neelam, do you know how many milk boxes are being sold in various hospitals and nursing homes? And I looked at it, I said, of course not. So they said that this 20,000 or whatever they wanted to say. So the message is that probably we need the nursing force to join with us. And I hope through the YouTube, you promised me there'll be 1,000 nurses who will join us, not only today, but the concept with which this alliance, so I don't want to say that it is an IIP initiative. Yes, it was just my thought, but in this initiative, all mails, all messages that are going to the policy health maker are going as everybody's name. So let me be very clear that this is everybody's babies. Therefore, in every flyers, every team, your names and all are first. And we are all joining together. And we just believe in this message that breastfeeding, for a sustainable start, what works? This is the question that comes in my mind. So throughout the 6 days, 7 days, what we plan is the various aspects, why it is important, not the issues about the IMS Act, what are we doing about the gut microbiome, what should we do in the maternal illnesses, what should we do, kangaroo mother care, are we going wrong? And all these questions that we need to answer, we think we know, but there may be some facts that we don't know. Inverted nipple, small size breast, twins, mother eating not well or drinking not well and having fever. All these questions we are going to answer. And through this alliance of breastfeeding, I think we also managed to get the ministry with us now. And I connected only yesterday, to be honest to you all. And we could manage. Most of them will join us in the coming days, whether it is Dr. Pawan, who's responsible as the additional commissioner for ministry, he's going to be with us. Shuna is going to be with us. Ma program is going to be with us. Neeti is going to be with us. All of them have agreed to be with us in this journey of voice that is not one IP, it is together. We are going to, and I urge all of you to please join on 4th. On 4th, this forum is coming out with a position paper, and this position paper is going to be launched on the 4th from 4:30 to 5:30. This experts will be launching on the 4th in presence of Dr. Pavan and the Commissioner of Health in the Ministry of Health. So together, we are going to make a voice for the people. And thank you for giving this opportunity to me. And I look forward to hearing the other presidents and their vision.
Thank you. Thank you, Dr. Neelam, for your very inspiring message. Now it's time to invite our chief guest, and I request our president-elect, Dr. Singravelu sir, to kindly invite our chief guest to give her address. Over
Thank
to
you.
Singravelu sir.
Thank you, Dr. Ruchira, our Honorable HSG, our respected President, and who made all the team members to join together, where with NNF and Foxy and our Nursing Council, which is a great initiative in the history, where today our chief guest who is going to address is none other than our own pediatrician, our own neonatologist, Padma Shri Dr. Armida Fernandez, ma'am, and who is all main persons behind the instrumental for all of us, and what she has done over a period of 4 to 5 decades, I can say. And I have been very much associated with her for a quite long time from the beginning. And she was the inspiration for all of us, and not only the pediatrician, not only the neonatologist, and the work she did to the community and to the nursing. So promptly our president has brought everybody into loop, where our chief guest she is going to address today is a great honor, and we wish on behalf of all this forum to congratulate, because we already congratulated her several times in person and various media, but this occasion for which she was awarded, she was awarded for his commitment to the upcare of our newborn, and that where breastfeeding is one of her brainchild promoting work, and it's apt that she is with us addressing in all forums, all major forums joined together, madam. And we are here to hear your voice rather than I talk. If I start talking about you, I have to talk hours together, madam. Then. So, but our people are very eager to listen to you. I once again thank our HSD, our president, Ganesh, and all the members who joined with this. Thank you. Thank you. Over to Ruchira.
Thank you so much. You embarrassed me with whatever you have to say, but thank you so much. I feel the love actually. I'm fortunate to have so many people with whom I have worked and who are doing such an excellent job. I want to start by wishing you a great week of advocacy for the promotion, support of breastfeeding. So this is an excellent start, and only Neelam, the idea she gets to form a breastfeeding alliance. And you know what I appreciate? Not only ideas, but she puts it into execution, gets the best people, and gets it running. So what better than to have you can't do it alone. I've realized it all my life. You just can't do whatever I've done, it is with everyone together. And this initiative is excellent because it brings together people who can change what is happening. You have the pediatricians, you have the neonatologists. Important for us, extremely the obstetricians and gynecologists and the nurses. And Neelam, I was just going to add, why not the government? And you said yes, they will be coming, but they'll come. So we need all to work together. So I want to say that really I've talked and talked and talked and taught all my life. I'm here actually to listen to this excellent panel that are going to speak. But like you said, gray hair, 50 years of working in this field and similar fields, I need to say a few things. And I've just a few thoughts, random thoughts. You can take it, or you might think that these are dreams or things that this old lady is talking about, but I just want to put it forward to you. The first is that I want to start by, because of the decades I worked in the field of pediatric and neonatology, I want to start by saying I feel a matter of pride. The infant mortality rate, the neonatal mortality rate has come down. The SRS data that we have, it's come down to, the Millennium Development Goals that we're looking. And we've done it actually, I've been watching for decades. In the last decade or maybe the last 2 decades, so much work has gone in by the government, by the pediatrician, by the neonatologist. So this is something to celebrate. And while we celebrate these good numbers, we're looking at, as Neelam pointed, what are the numbers? You're like here to talk about numbers, what is happening, what needs to be done. What is it that has happened that has actually as far as breastfeeding is concerned, if you look at numbers, actually there's been a slow, more increase, some slowly, some more rapidly in all the breastfeeding things that we were talking about. There is a decrease, like Neelam said, and we feeding in the first hour of life. It is not Indian, not traditional. It has never happened over the years. So that's one thing one needs to push. And actually, exclusive breastfeeding has decreased. So why has that decreased? This is what we are here to talk. Why has it decreased, and what are we going to do about it? And that is what. So, what I want to start with, where do we start? And when we start promotion of breastfeeding, everyone says, let's start in the antenatal period. I want to give a thought, and maybe you all can take it forward. But antenatal period may be too late. Ideas of breastfeeding should come in very early in a different form. We are talking about to children about sex in school, and we say that no, they have to know because this is might happen, and therefore we are informing. So how do we inform them about breastfeeding? And what about textbooks in school children? I'm not saying we're not going to give them positions and the details of breastfeeding, but that is the best nutrition. What about having pictures of a mother happily breastfeeding a child, a mother happy, baby happy? So the thought of breastfeeding goes not only in the girls in the school, but also in the boys. So start early. The second big period that we are missing is adolescent girls. Many of them might, few of them hopefully, might get pregnant in the adolescent period. And therefore, we have adolescent clinics, and we're talking about nutrition, we're talking about sex, we're talking, but we are also doing that. Why not start in that adolescent clinics when we talk about nutrition? Give them ideas about how their siblings in at home, what is the best nutrition for them, how breastfeeding helps. So the thought of breastfeeding goes from childhood to adulthood. Maybe we have we have probably we've started antenatal, we have to start earlier. So that is one thought that has come to me, and you can keep about it. The second is, what are we doing in the hospital? Hats off again to the government. The institutional deliveries over 90% in our country. Wow, great job. But the question I want to ask, and we may all ask each other, do we have sufficient staff? We might have just enough to deliver them. Do we have sufficient staff in those hospitals to support mothers, counsel mothers in breastfeeding practices? Do we have them in the labor room? Where is the time? Delivery after delivery, breastfeeding crawls. Look at the tables we have for deliveries, keeping the mother on the breast. Is it possible? What is it do they have in the delivery hall? And is there some solution? Because numbers in India are formidable, and everywhere is a, how do we manage these numbers? Just an idea, and like I said, gray hair talking. My idea is, over the years, many parts of the
Hello.
world, they had what was called a dawla. And who's a dawla? A dawla is someone from the community who supports the mother. And she's worried, I'm going to the hospital for delivery, I'll be alone in the delivery room. And therefore, if we train that dawla, and she's not doing other things like other our nurses and counselors and all of them, her thing is to be there supporting the mother. So can she be trained? I'm glad the obstetricians are here. So I must ask the obstetricians, is there something, because this is what we want to do. And most important, be there holding the hand of the mother when she cries, she's in pain. Can we have a Zawla then who can support and help those, the doctors and nurses and counselors or whoever is into it, because they may not have enough time. So that is a second thought that I thought of. The third thought that comes to my mind is, we talk about postnatal clinics and we say, oh, you must support mothers in postnatal clinics. When we have in the villages, rural areas, to reach the hospital because there's money, they will come to the hospital. Once they go home, where is the transport? Will they ever come for postnatal care and clinic? And therefore, yes, and the usual answer we say, let's get the ashas to work. Let's get the community health workers, Anganwadi workers, whoever is there to support. Please stop and think. Do you know the number of things ashas are being trained for? What is the work that she has to do and document? What is the pressure put on that woman? Yes, she's also asked to counsel. We say ashas can also counsel. There are studies to say that she could be a counselor even if there are mental disease. Everything that happens is poured on on the heads of these ashas. So one thought I thought, because for the last 30 years I'm working in the slums, we've looked at the power of, we work with ashas and Anganwadi workers, we work very closely with them. But what we have found is the powerful people who can be in those slums are community health workers. Volunteers. We have over 7,000 volunteers in the slum. And these volunteers are willing to give some of their time. They don't want to be full time paid. And you'll say, how come they are volunteers? Remember, these are not people who have money. They're willing because they feel good about themselves. They've learned a skill. People are now listening to them. If they have a problem, oh my, you'll ask a volunteer, how can you help? So can we have volunteer groups in the slums to support these ashas, support ashas, community health workers, and support. So, just another thought that I want the panel and everyone to think about it. And the important thing, what is it that is, decreasing the levels and not we can give a lot of. I want to ask everyone, what do you think is the role of cesarean section in decrease, at early contact, early feeding, exclusive breastfeeding? What is the role of cesarean section? And we have done a study, Sneha has done a study that's been published recently in the last 2 weeks on breastfeeding nutrition practices with LSCS. And cesarean section mothers have a lot of problems in feeding. So when we say that we get mothers to feed, they will be able to feed, put in 1 hour feed. Think of that mother. This is the studies show us, can we work on that? What can we do about the cesarean section? How can we support the mothers? So that's a thought that I think all obstetricians should look at, but we as pediatricians, neonatologists, we want to breastfeed, if that's a thought. Again, Neelam mentioned what is another problem that we have is mothers with feeding problems. Congested breast is simple, even an abscess is not, but inverted nipples can be a huge problem. And for months, people are trying to pull it out. So, how do we deal with those problems and who will support that? The next point is the working mother. We say 6 months maternity leave and all. Who gives 6 months? Government? A few corporates, many of them don't. Forget about the government corporates. What about the non-registered workers? Most of our women are working in the fields. And look at what happens in the slums. They're all domestic workers. I want to ask all the people here, how many of you all, when your domestic worker is having a baby, says, don't worry, I give you 6 months leave to breastfeed your baby or bring your baby here. And when you come back, your job will be waiting for you. So that is a huge segment. Please let's look at that. How do we get people, lay people, to support these domestic workers? What about the people who work in construction work? So what is it that we can do for these construction workers is another thought. Yeah. And the last,
Sorry, ma'am. Somebody got unmuted. Armita, ma'am, you have to mute yourself. Armita, ma'am, he muted everybody because someone was a bit careless.
I think they wanted me to stop speaking. They might have been intentional. Last point I want to make is I think we need to empower women and tell them, yes, you can breastfeed, how you can breastfeed. We've done it from the school days. But another thing that we need to do is we don't criticize them. I've seen, people who come around for rounds, even doctors, nurses. That's not the position. You have to hold the baby like this. I said, don't criticize her. When you counsel, you say, oh, you're doing a good job. What if you lift the baby and keep closer? Will it help? So that criticism is tough. The second is when a mother has an LSTS baby, the worst thing for a mother is to hear that baby cry. And I've heard people saying, no, 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 doesn't matter. The baby is crying. Keep putting to the breast. Milk will come in milk. She's got pain from LSTS. The baby is weeping. They her newborn baby. She's waiting for, and we're telling her, don't worry, it is normal. No mother should hear a baby cry. You must do something about it. And remember, that crying, that pain will decrease oxytocin level. So I think finally, last word, I have to say uh, that if we were talking about sick and preterm babies, and therefore finally, if we really want all sick preterm babies, we have to, in a way, promote human milk banks. It's an ancillary to breastfeeding in large hospitals with large neonatal care units. If it's not milk banks, you can have lactation units where they can help mothers. So thank you so much. Sorry, I've spoken for so long, but few ideas I want the panel to discuss and looking forward to hear from all of you.
You, Armida ma'am, and I just wanted to tell all the participants that deliberately we did not want to have in the inauguration somebody from the ministry. We thought someone who's been with us, one of our colleagues, and who has the wisdom of years of experience should be there. So, as you rightly said, Armida ma'am, you spoke through your wisdom, but obviously I did not ensure that they are left. They will all join. There are 4, 5 people, but I didn't want to start with them. I thought you could be the best batsman for a good start for this breastfeeding week. So thank you that you proved us right. And I'm longing to hear Bhaskarji. Over to Ruchira.
Thank you.
Thank you, ma'am, for your words of wisdom. And I'm sure our moderator and panelist will definitely ponder on the points which you have raised very valid points, actually, ma'am. Thank you very much. Now, it's my proud privilege to invite a very visionary leader, an outstanding obstetrician and gynecologist, and the president of Foxy, Dr. Bhaskar Pal, requesting Dr. Bhaskar, sir, to kindly
Thank you.
share
Thank
your
you,
wisdom on this
Dr.
topic.
Thank you,
Thank you.
Dr. Ruchira. At the outset, I must congratulate Dr. Neelam Mahan and IAP for taking this initiative. And as you heard, that there are 4 organizations, IAP, NNF, Foxy, and the Indian Nursing Council, who are coming out with a joint statement. We are also actually working on a collaboration hub so that we all come out with a unified message on different matters and so that we are on the same page. Dr. Neelam pointed out that the early initiation of breastfeeding, we're still around 50%, while our institutional delivery rate is now around 91%. I believe this is not a problem with knowledge. All of us are aware that breastfeeding is the most effective and affordable public health intervention, not only for newborn survival, but also for their growth, their immunity against infections, and reduced risk of NCDs in future life. The problem is translating the knowledge into action. So we need to look inwards and see where are the gaps. Why can't we initiate early breastfeeding? Why can't we promote exclusive breastfeeding for 6 months among our mothers? We have discussed this before, and this is not a problem, something to do with only manpower or only economics. You go to top hospitals and you will see that babies are sometimes not rooming in with the mothers, as exclusive breastfeeding is not being promoted. So that's why it is a need for a collaborative statement, all of us making a strong statement. And we know the theme for this year is breastfeeding for a sustainable start in life, strengthen what works. And it underscores the importance of strengthening the proven interventions to promote early initiation within 1 hour of birth, exclusive breastfeeding for the first 6 months, and laying the foundation for the best possible start. Anvita Fernandez, madam, spoke from her experience, gave us useful insights, but Cesarean section at the present moment should not stand in the way of early initiation because most of the cesareans happen under uh, regional anesthesia. So mothers should be able to initiate breastfeeding pretty early. This will require a lot of awareness among the society, among the employers, as madam said. But let us start with what we can do immediately to raise this uptake of early initiation of breastfeeding from this dismal 50% to very much better figures. And that's why I think we all need to be there. And breastfeeding, observation of breastfeeding week is for a week, but this is something we need to continue every day, 24 hours a day, in all labor rooms and in all hospitals. Thank you very much.
Thank you
Thank
very much, Bhaskar. And I absolutely, you'll be surprised that for all the pediatricians, I want to give this message that while we were talking about and coming out with the position paper, all the presidents, you will be surprised his contribution is extremely significant. Whether it's Lalan, whether it's Bhaskar, whether it's everybody is, head on with the fundas. Thank you so much, Bhaskar.
Pleasure.
And thank you, Bhaskar, sir. Your presence itself shows your shared commitment. Now it's my pleasure to invite the National Neonatology Forum President, Dr. Lalan Bharti, to share his vision on this topic. And we know that your leadership is definitely to focusing more on strengthening newborn care. Over to Dr. Lalan.
Thank you, Dr. Ruchira. Good afternoon, everybody. Respected chief guest, Armida ma'am, other dignitaries, colleagues, faculty members, and dear friends. It gives me immense pleasure to welcome you all to the inaugural webinar of this Breastfeeding Alliance initiative. As everybody was saying, a landmark initiative bringing together the 4 leading professional organizations with one shared mission. So IAP, NNF, FOXY, INC have come together with one shared purpose to protect, promote, and support breastfeeding, having one mission, one message, and one voice on this important issue. So friends, we all know breastfeeding is not just a feeding choice. It is a foundation of lifelong health. It saves newborn lives, protects mothers, strengthens families, and create a healthier society. Yet, despite strong scientific evidence, many mothers continue to face barriers due to misinformation, lack of support, and guidance. That's why this alliance is so important. My special thanks to dear Dr. Neelam for this initiative. Over the next 7 days, experts from all the organization will share evidence-based knowledge, practical skills, and real-time experiences covering every aspect of breastfeeding. As a newborn healthcare provider, we see every day how first few hours after birth can save baby's future, like early initiation of breastfeeding, skin-to-skin contact, then continuation of exclusive breastfeeding for first 6 months. These all are among the most effective intervention to reduce newborn illness and mortality. I sincerely thank the leadership of the IAP, FOXY, INA, Dr. Neelam, Dr. Bhaskar, Dr. Dilip, Dr. Ruchira, of course, our secretary, Dr. Amit, Suvarna, for joining hands together in this historic nationwide movement. My special appreciation goes to dear friend Dr. Ganesh, the coordinator for this outstanding, for his coordination. I also acknowledge the dedicated effort of Dr. Asa and Prashant from the IYCA. So friends, together we are sending a strong and unified message that every mother deserves the right support, the every newborn deserves the best start in life. I invite all the respected members to actively engage in these sessions all 7 days, share experiences, and carry this message to your hospital and communities. Let us work together to ensure that every delivery room becomes breastfeeding friendly. Every healthcare worker become a breastfeeding champion, and every family receive the best support they need. So together, let us protect, promote, and support breastfeeding for mothers, baby, and healthier India. So thank you once again for giving me this opportunity. Wish you all a very enriching and inspiring week ahead. Thank you.
Thank you so much, Lalan. It could not have been possible with you without your vision. And thanks for all the stupendous support. And thank you for coming out with guidelines. I would like to remind all our colleagues that thanks to the support of Lalan, this time we are having IIP NNF guidelines, which are uniform for the first time that common guidelines is coming in neonatology. And that's how you will have this position paper, which talks about every association will be publishing this so that there is no difference in what we are going to communicate. We will identify the issues that are going to be there subsequently and address this. This is a journey which has just started, and I think in the next 5 months to come, we have a lot of work on our shoulders to ensure this is completed. If we could finish the position paper through all the references, everybody worked hours and hours and hours. Thank you all for it, the support that we have. And I'm looking forward to the vision of Dilip ji and Ruchira ji will introduce.
Thank you. Thank you, Dr. Lalan, for your words of wisdom. Now it's my proud privilege to invite a dignitary who recently has been elected as a board member of International Council of Nurses for Southeast Asian region. The first Indian nurse to be appointed for this, none other than the president of Indian Nursing Council, Dr. T. Dilip Kumar. Dr. Dilip, kindly please share your words of your approach or your vision on this. Thank you. Over to Dr.
Good.
Dilip.
Am I audible?
Yeah.
Yes.
Good evening. Greetings from the Indian Nursing Council to all of you. I think we are very happy, Indian Nursing Council and also International Council for Nurses, which is representing 140 countries. And the first time India has got into the club of ICN as a board member. So this is an issue which even the International Council for Nurses, which is debating and promoting how best globally the breastfeeding, the promotion should come, and we should all together. I think especially all the stakeholders are here today. I think we would like to congratulate for this initiative. And every year when August comes, we come together to recommit ourselves to one of the most natural, transformative, and life-saving interventions in human health, the breastfeeding. This year, as coordinated by the World Alliance for Breastfeeding Action, WHO, and global health partners, we unite under a powerful theme: breastfeeding for a sustainable start in life, strengthen what works. As we look at works, one model stands out as an exemplary beacon of success. At least the Indian Nursing Council for a long time worked with the stakeholders like Foxy, NNF. We were able to come out midwifery-led care, which is getting popularity, and this nurse practitioner midwifery, which has become a part of the Pan India program under the National Health Mission, I think now many people, like in Meerut, I have seen how pink didis, the pregnant mothers, want to have a care from them. So now the pink didis are becoming more popular, and their the work of the antenatal care and also working with the family. I think we have to involve the more family in this, so that they need to be educated in the antenatal care, and also while planning early care. So therefore, this midwifery-led care, which is becoming like in Varda, successfully in Meerut, even in government institutions, it is becoming popular. So therefore, the our auxiliary nurse midwives, the ashas, especially at the health and wellness centers, where they are interacting with the family members, which is so the family members and also the various stakeholders, their continued support, continuous education, especially our nursing professionals who are in a large nursing human resource in India, especially in the rural area and the at the community health centers. So now the mid-level health provider, which is many of the states which has they have adopted these mid-level health provider and also called as a community health officer, happen to be a qualified BSc nurse, which is making a big impact and outcome at the community health center level for all the maternal and child health services. So therefore, they are the one of the good human resource need to be tapped, and need to be continuing education has to be one of the part. And this total the 1 week what the plan of the panel discussions, I think the ultimately after this panel discussions we are coming out with the white paper and the statement, giant statement, definitely submitted to the Ministry of Health, and hopefully they will be able to take further with the state governments, because this is not one man's job. This is a the all the stakeholders have to come together, and especially we are already, as per the National Health Mission and the Ministry of Health and Family Welfare, we are already in the right direction of achieving the Sustainable Development Goal. WHO has very clearly said that if no nurses, no universal health coverage. So that is the global statement which has been given by the WHO, and that's how the State of the World Nursing Report, State of the Midwifery Report also has given a launch of the four themes: investment and the creation of the positions, the leadership, and the service delivery. So all these four components boils down to provide a qualitative services. And breastfeeding is one of the very important in achieving the neonatal mortality and also achieving the infant mortality. Wherein the government of India is in the right direction of achieving the sustainable development goals. So therefore, this midwifery-led unit care, I think we involved the FOXY in developing the curriculum itself. The NNF also was involved. So this needs to be further strengthened, and the National Health Mission should take all the four stakeholders into confidence in making further plan of action, so that this movement what we have now started, it is to be sustainable, continued, and also we should involve this component in our continuing education program, so that the momentum need to be created, so that the even the family and also the professionals has to be kept in latest developments, so that they will be able to participate in a effective. As our chief guest was mentioning very important points, the workforce, the numbers. I think in India we have, I think the at least in terms of the nursing profession, I can tell you the optimum nurse patient ratio, whatever the government of India has suggested, many of the state governments are yet to achieve this norm. So having the adequate number of professionals at the labor room and in the hospital is a big challenge. So therefore, in the given the shortage and also not having enough human resource, we have to use, I think our ashas are doing a job, and we have to involve the family and also especially the working mother, as madam was very rightly pointing out, the working mother and also the construction worker I think we are in the nursing professional in our community health nursing program. We reach out to the community and health education. This is breastfeeding is one of the important activity our students undertake during their community health nursing postings. So with all this, I think we have the enough idea. The knowledge is there, but we have to get together, put all those action for implementation. So our the target of ensuring the breastfeeding, 100% breastfeeding, it may not be difficult if we all work together. I think this 1 week deliberation will go a long way for the future plan of action to the Ministry of Health and Family Welfare. Wish you all the best of luck. Thank you very much.
Dilip ji, I just wanted to put in one message for you. That is, if there is, I was actually planning out this and I was thinking of putting it to you, so I'll put it now. Is that in case we come out with some structured teaching program for the nurses, IAP will take all the cost which is involved in it, because for the first time we came up this year also with the nursing teaching module, which we are doing for the basic recognition of cases in the ward and how to immediately, do the first line management before doctor gets invited, is comes in. So all the training is going on. And if you want, I would endorse that the module and the teaching and the platform, because I talked to some other platform who can support in this, and the entire cost can be borne by IAP. But if you are happy that all the nursing under your care, may I know what are the number of nurses that are registered under your in your group, sir?
So as on today, we are the only regulator under the Ministry of Health and Family Welfare having a nurse registration tracking system, live register. Still, we are yet to achieve, but at least as on today, 14 lakh nurses. We have captured the name with the latest telephone number, with the latest email ID, with the latest photograph, with the latest email ID. So we have a large number are there. Definitely we can reach out, and
So
one of
if you
one of
are
the one
interested,
of
sir, we'll talk this
yes,
and we will support this completely, sir.
definitely let us work together. No problem.
I wrote that in my that. And before you leave, Sachi, can I request you to project all four, what do you call that show, the presidents and secretaries, whoever are there, a group picture ho jaye, Armida and all the presidents, Bhaskar, Dilip, Lalan, myself, Ujira, and the other secretaries that are available in case Amit and Shivangi and Sabjit are there. Can you just showcase the light and take us into a picture, Saji?
Yes, ma'am.
Okay, please throw light on us and we come in a picture.
Saji, put up spotlight, Saji.
Spotlight.
Yes.
Ganesh, you can take the picture when the
Yes, ma'am.
presidents join, and then
Yes, ma'am.
Dr. Singravelu Ruchira.
Saji, Dr. Armida ma'am, Dr. Bhaskar Pal sir.
Yeah, now at least two. You keep taking pictures, Ganesh.
Yes, ma'am. Dr. Lalan sir. Saji, Dr. Lalan sir.
And Dr. Bhaskar.
Dr. Bhaskar sir. Dr. Ruchira ma'am.
Dr. Singravelu Ruchira.
Singer Velu sir.
Bhaskar is not there?
Dr. Bhaskar sir. Dr. Bhaskar Pal sir.
Dr.
Bhaskar
Bhaskar
sir is
actually
not there.
for another meeting. He just
Are you,
in the
sir?
group.
So do we have Suvanya?
Yeah, Dr. Charulata ma'am is there. Charulata ma'am, you
Can
can.
I request Dr. Amit?
Okay, let's take
Amit-
a picture this way at least.
And Dr. Boyer madam is there.
Who? Who, sir?
Dr. Boyer madam.
Amit is there? No?
Dr.
Amit
Amit,
Upadhyay.
Amit,
Amit Upadhyay, please.
Dr. Sneha Bhoyer, madam. And Dr. Sarvajit Kaur, madam. And Dr. Sarvajit Kaur.
Saroj.
Sarvajit Kaur. Kaur,
Sir,
madam.
I'm here, but somehow my video is not getting on. I'm so sorry.
Okay, then
I'm
let
trying.
we will just finish. Others are waiting.
So I guess, sir,
Thank
we
you.
have almost maximum 8.
Yeah, that's okay.
Fine, fine.
Take a picture.
Yes, ma'am, I have taken.
Yes, ma'am.
Thank you. And we can use it in the Child Indians magazine.
Thank you so much.
Thank you. Thank you disturbing everybody.
you.
And I
Thank
think
you.
now
Thank you.
the Ruchira, with your permission, we can move on to the academic one now.
Absolutely, ma'am. Before that, just wanted to put some acknowledgement to Dr. Amit.
After this or now? Okay. As you
Just
say.
one acknowledgement
Sure,
because they
sure.
are present right now.
Sure,
Dr.
sure.
Amit, the secretary of NNF, Dr. Suvarna, Suvarna from Secretary General of Foxy, and Colonel Dr. Sarvajit Kaur, Secretary of INC, and along with Dr. Asha Benakappa, Program Coordinator, as well as Dr. Ganesh for coordinating, along with Dr. Rupa Bellad and Dr. Prashant from IYCF chapter. And now we can move on to the panel discussion.
Yeah, Asha Benappa is the convener while the other is the coordinator. Thank you so much. And may I request Ganesh to invite the first day theme people?
Hello. Yeah, very good evening, ma'am. This is a pleasure and privilege to me to invite today's moderator, Dr. Anitha, ma'am. She's going to moderate on a session today, and to join us, we have eminent panelist, Dr. Ruchi Nanavati, madam. We all know her for her contribution in the field of neonatology. She was my teacher also. And we have with us Dr. Lalan Bharti sir, who's the chairperson of NNF, who's going to join as a panelist as well. And top of it, we have Dr. Jyoti Saran, ma'am. She's coming from INC. And we have Dr. Sneha Bhoyer, madam, from Foxy. So these are all eminent Foxy, IEP, NNF, and from INC. We're going to have a wonderful discussion on the topic today. Madam Anitha, I would request you to share your slides and introduce our panelists. Over to Dr. Anitha, ma'am.
Thank you, sir.
Saji, you can share the slides.
Yeah, please share the slides. Yes, good evening, one and all. Welcome to the World Breastfeeding Week 2026. Today's topic is about the World Breastfeeding Week theme and about NFHS 6 statistics. Next slide, please. We heard our chief guest give her thoughts on this theme. The panelists for today are Dr. Ruchi Nanavati, ma'am. Welcome, ma'am. She's a panelist who is going to represent IIP. Madam is a neonatologist and she's a professor and HOD of KM Hospital, Mumbai, and she has served in several leadership roles within the IIP as well as the NNF. So welcome, ma'am. Our next panelist is from the NNF, who is our national president, Dr. Lalan Bharti, sir. He's a leading advocate of evidence-based neonatal care, most importantly, the golden hour management, early breastfeeding, skin-to-skin contact, and QI initiatives across India. Welcome to you, sir. Welcome to the panel. Our third panelist for today is Dr. Sneha Bhoyer, ma'am. She's a panelist who is representing Foxy. She is an obstetrician and she also held the post of the breast committee under the Foxy in the previous years. So welcome to you, ma'am, Dr. Sneha Bhoyer, ma'am. Our fourth panelist for today is Dr. Jyoti Saran, ma'am, who is the panelist who's representing the Indian Council of Nurses. The Indian Nursing Council, she's a panelist from the INC. Welcome to you, ma'am. So we have four panelists for today's discussion. Let's start the discussion about what is today's theme. Dr. Neelam, ma'am, do you want to speak on
Yeah,
this and
okay,
the
I'll just talk one
Yes,
or two and then
yes,
Nike, you
yes.
can take over. Thank you
Over
very
to you,
much.
ma'am. Yeah.
Yeah. With the experience of knowing that we've been giving different themes, and ultimately this year theme is it says strengthen what works. There is a deep meaning beyond it because the issue is not the same globally. We have seen that there are issues when we said there may be issues in the people who had cesarean or who've been preterm or who's been low birth weight or who's the mothers are ill or somebody who's in a worker, somebody who thinks cannot get leave and mother needs support. So there are so many issues that we want it to be addressed. And therefore, I love this theme because it says that for a sustainable start in life, the reason it says sustainable start in life, all the presidents have impressed us that it is not a mere nutrition, it is about life, something which can change and give you protection from mortality is what we want to emphasize. So that is why this theme, which is being followed from 1st to 7th August and coordinated not only by the Ministry of Health and Family Welfare, and that MA program has also been started now in India. And as I said, all stakeholders will be there while looking after mother, child, ministries, and MA program. Everybody will be with us to talk uniformly about the WHO UNICEF Alliance. And in this year, we want just like it says, the theme, it says, strengthen what works. I thought it could be no better time than this to have all the stakeholders coming together in alliance. And I think sometimes the messages come from Almighty. I was thinking of doing a program, IAP and IYCY, and I appreciate that everyone has the right to have their own programs. And while they were doing this, it just occurred to me that yes, in case we are there, why not get this? And I'm very grateful to Almighty for this thing that I could think about. And the relevance of this thing is cannot be better understood through the NFHS 6 data indicators. Next slide, please. And these indicators have just shown us that because they are the most reliable and 23-24. So the nodal center that was there was the IIPS Mumbai, and the NFST 6 fact sheets were officially released on the this year in May end. That was released, and it came as a shock because everybody was expecting them to be, because we were better than what the WHO standards. Next slide. We were better than the WHO standards, which had talked about the next slide, breastfeeding rates. And in that, we were expecting things to move. But this key indicators, which had 101, one of them in the maternal and child health, and the other parameters we are aware. And the breastfeeding indicators, normally we look at 1 hour and then 6 months exclusive, and then we move on. What I heard one of the policy maker suggesting me, but obviously this is not incorporated in the data. She said that the data was better probably when they looked at the first 4 months, and they were trying to justify that maybe when the mothers went for work, is it related to that? But having said that, this is how we need to address it. We do not have that data up to 4 months. So what is there? It talks about it. And it looked not only in the first hour, then the 6 months, and continuation of it at 1 year and 2 years, or ever breastfed, or 6 months did we start complementary feeding or not, because that is also an important factor to say that we need to start complementary feed and continue with breastfeeding. Next, please. And that data, and we have been talking about first 1,000 days, which starting with pregnancy, and therefore, like Amida ma'am was saying, that is it only time to talk about it from pregnancy? And now, when we go in, when a mother goes, the best time they think is it the second trimester or the third trimester, and majority of them feel it is time to involve the fathers too during this pregnancy when they are talking about the importance of breastfeeding in the there, and what maternal diet needs to go is an extremely important part during this journey of 1,000 days, which clearly indicates that it is not genetics, but it is epigenetics which also matter, and that epigenetics is what the mother eats and what the baby gets determines what the baby's future is going to be in terms of health, not only in terms of mortality, next please, but also in terms of long-term metabolic health, which is being determined, next please, is determined with the amrit that the baby gets. And this amrit, which is nothing else but the breast milk. And this facts which said that though there was an improvement in the antenatal visits, antenatal care, all these visits, we're talking slightly better, but surprisingly, I mean, even the iron folic acid consumption, all this showed an improvement in the antenatal care. Next, and therefore, we need to understand that if there has been an improvement in this antenatal care, it is during this time that they need to talk about. Next, Saji, they need to talk about it to the mothers during this visit that needs to be emphasized. Are you sharing, Anita or Saji? Who's sharing it?
Saji, ma'am, I'll talk to him. Saji, please next.
Can it be Anita herself for future? Because in case it's always better, we should make the host give that to Anita. This is going to be easier. So what I wanted to emphasize is that while there was improvement in antenatal care, while there was improvement in iron folic acid, still improvement in institutional deliveries, still there was a drop in the breastfeeding exclusive rate. But yes, when it came to early breastfeeding, there was an increase. Next, please. And this data showed that there was an increase in 17% in the cesarean. And that I would leave to the team to discuss what were the issues, because these are also being addressed by the gynecologist, that there has been an increase in cesarean by 17%, and they're addressing those. But the mothers receiving postnatal care within 2 days was better. The newborn receiving postnatal care was slightly better. Next. And therefore, probably the early initiation, we were better. We were better because early initiation went from 41 to 50%, but where we gooped up was 63 to 55 in the exclusive breastfeeding for 6 months, as the data suggested. Next, please. So this is again an overall suggestion which I gave 5563, but they have looked into the various states which performed worse, and there are some red states which is very important for those who have joined. In case we have our EBs, Manjeet and Monica joining, it gets the responsibility to see that Punjab was one of the lowest performing rate also with less than 35%. And it is time that Kerala also revisits its, Tamil Nadu, Kerala have been doing very well when it came to health, but they were one of the lowest state with less than 45%. And surprisingly, Delhi, the capital of India, was also number two in the worst with less than 40%. And everybody had great hopes from Goa, from Kerala, from Tamil Nadu. So it came as a disappointment to see these states. And yes, it needs to be congratulated to states like Lakshadweep, Chhattisgarh, Meghalaya, Orissa, Jharkhand, Mizoram, Tripura. A big congratulations to them because these were the states which ran ahead in improving the data nationally, while there has been a decline in several states. Next slide, please. So I would now hand it over to Anita to take the further discussions. And thank you for giving this opportunity to me to present the NFHS 6 data. Thank you.
Thank you, ma'am, for summarizing the NFHS 6 statistics, right from antenatal to natal to the exclusive breastfeeding statistics. Now we move on to the panel discussion. Here is the first question. It's to the IAP panelist, Dr. Nanavati, ma'am. India has achieved a remarkable has declined in the NFHS 6. So where are we falling short along the continuum of care and what factors could be driving this decline?
Thank you very much. What I would like to say that it is really a noteworthy achievement when we say that institutional delivery rate is 95%, because just 10 years back in 2015 and 16, it was 79%. So from that, now we have reached to 95%.
But that also this we stopped sharing so that the presenters are seen because all our questions, there's no answer. So you can say the questions so that the light goes on the speakers, if that is okay. Shaji, if you stop, then the light will go on Ruchi.
So, it is a very noteworthy achievement to see that the delivery rate, institutional delivery rate is 95%, because just 10 years back in 2015 and 16, it was 79%. But at the same time, the statistics tells us that though the institutional delivery is 95%, giving birth in a facility does not automatically translate into optimal breastfeeding support. In fact, such statistics tells us that the quality and continuity of breastfeeding support needs greater attention. Now, if we look at what are the gaps, and I'm not going into the very much details because we have heard, madam, and we have heard Dr. Neelam. So gaps occur at multiple stages, and breastfeeding counseling during ANC may not be consistent or may be brief. The early skin to skin contact and breastfeeding within first hour after birth may be missed. It is not yet done in many medical colleges also, and the duration might be less. The increased rate of cesarean section, which can delay the breastfeeding initiation if appropriate support is not available, which is again a truth. And many mothers leave the facility, hospital, without even, heard to a lactational trainer or without observing a full breastfeeding session. In addition, there are shorter hospital stays with limited lactational counseling. Follow-up support may be insufficient. Home visits might not happen frequently in the babies who are born at home, because when we say that 95% are born in institution, 5% constitutes to 1.2 million, because we have 24 million neonates born in our country every year, and 5% comes to 1.2 million. So if these babies there are no home visits by the workers, healthcare workers or other supporters, then what does happen to this baby? So this is again a very important issue. And second is, so finally what we come to is that there is a reduced continuity of counseling from pregnancy through the infancy and early childhood. So we require to work on all of this to get into the proper breastfeeding. Yeah, thank you.
Thank you, ma'am, for pointing that 5% is actually 1.2 million newborns missing out on institutional births. And that is a very big number. 5% looks small, but 1.2 million is to be highlighted here. So the next question to you, ma'am, is how can we collaborate as a team? We've been talking about collaboration alliance. And who should ideally lead this team? Who is the team
I think
leader?
breastfeeding. Yeah, right. The breastfeeding support should be viewed as a continuum of care, with every provider should reinforce the message on breastfeeding at every contact. It should be right from the school age, as Madam Fernandez said, in adolescent period, pregnancy, birth, in hospital, before discharge, in community. It should be an ongoing support, and the consistency is very critical. So as Dr. Neelam has said, it's a shared responsibility. It is shared responsibility, and mother should remain at the center of care. So whosoever is there, dealing at obstetrician, neonatologist, pediatrician, your center of, where you are going to put the efforts is the mother. And if we collaboratively work, we will have a different statistics in the next NFHS.
Thank you, ma'am. Thank you for your inputs. The next question is to our FOGSI representative, Dr. Sneha Buyar, ma'am. So the question is that we know that already that antenatal breastfeeding counseling, early skin-to-skin contact, early initiation of breastfeeding are all evidence-based practices. They improve breastfeeding outcomes. So this is known. But how can we strengthen these evidence-based interventions and translate them into routine clinical practice across both public as well as private sectors?
Hello.
Yes, ma'am. Dr. Sneha, ma'am.
Yeah. So as we said, yes. Hello, everybody. Yeah. Can you hear me?
Yes, ma'am.
Can you hear me?
Ma'am.
Yeah. So as we say that, antenatal care is the single best intervention for the best pregnancy outcome, that is maternal as well as perinatal outcome. Similarly, breastfeeding, as per recommendation, is the single best intervention for the long-term outcome, for the quality of care of that baby. So basically, preparing that mother for breastfeeding is the obstetrician's responsibility. It should be, preparing the mother should be physically as well as psychologically reflects is a neurohumoral reflex, and that is where psychology plays a major role. So anything, the fear, the anxiety, the worry, the doubts, all these things definitely, matter or hinder the oxytocin reflex. So there, if at all we want to have the successful breastfeeding, we have to prepare this mother right from antenatal period. So at least 2 antenatal sessions for counseling should be a must. I hope all of you can hear me. Hello. Yeah. So having at least 2 antenatal sessions. First one at around 28 to 32 weeks to sensitize the mother. I think somebody is unmuted and there is
Saji, please unmute.
Hello.
Saji, please unmute all.
Yeah, so there should be 2.
Madam, unmute yourself.
Unmute yourself, ma'am. Please unmute yourself.
Yeah, have done that. So there should be at least 2 antenatal sessions, one at around 28 to 32 weeks, to sensitize the woman, the pregnant woman, to discuss about what are the physiological changes during pregnancy, what is breastfeeding, what is colostrum, what is the position of the mother and baby, what is effective latch, what should be the feeding schedules, etc. So what are the benefits of breastfeeding to the mother and to the baby? So all these things, should be informed to her well in advance. What is 24 hours rooming in, what is skin to skin contact, correct effective feeding schedules. So how to know whether the breastfeeding is adequate or no? All these things should be well informed in advance. And of course, special situations, especially the preterm babies, twins, cesarean section, all these things should be discussed with her. And the second session should be between 36 to 38 weeks, where actually the practical breastfeeding comes closer. So we have to actually give the practical demonstrations of breast anatomy using models, positioning, deep latch, expression of colostrum, the various positions, and all these things should be, discussed, so that the woman, pregnant woman, should be well prepared physically as well as mentally. And to help her, in fact, we recommend that her family members, especially the husband and even the in-laws, should be involved in these antenatal sessions. We have to, of course, later on audit the quality indicators also whenever she's doing this breastfeeding. So to maintain the data, we have to have the percentage of what is the antenatal counseling, whether what is the percentage of pregnant women who have completed their antenatal counseling, what is the percentage of skin to skin contact within first 5 minutes, and of course 24 hours rooming in, what is the percentage of breastfeeding within as soon as possible and within first hour, what is the percentage of exclusive breastfeeding, what is the percentage of formula supplementation and what was the reason for that, and of course the admission rate because of the feeding issues. We should actually have, first is the antenatal counseling with involvement of the family members. Second, there should be labor room bundle, that we should have a labor room protocol, that these things must be followed, like delayed cord clamping, at least 60 seconds to 2 minutes, the cord should be delayed. There should be delayed clamping. There should be immediate skin to skin contact, no unnecessary suction, drying, etc., giving vitamin K immediately. In fact, there should be absolutely no separation of the mother and baby. Breastfeeding should be as soon as possible. I would like to quote the Government of India initiative MA, the Mother's Absolute Affection, where the whether it's a vaginal birth or a cesarean birth, the baby is delivered on the mother's abdomen, and even before cutting the cord, the baby should be attached to mother's breast. In fact, the staff, the nursing staff, whosoever is there, even in the operation theater, should just assist and support the baby and allow the baby to suck. It may happen that the baby even crawl towards the breast and start sucking on its own. So breastfeeding within first hour is very, very important. We have to just observe that whether there is effective latching, and we have to document the timing of the first feed. Staff training is very, very important. I just heard Dr. Mohan talking about the nursing staff training module. So let me just quote here that as a chairperson of Foxy Breast Committee 2021, for 3 years, we have run a project called as the Saheli. It was a complete module in 11 different languages all across India. And we have trained more than 10,000 nursing staff, almost 3,500 facilities. So this is very, very important because the support of the family members, the support of the health providers and healthcare workers is very, very important. So following all the recommendations by WHO, UNICEF, Baby Friendly Hospital Initiative, and of course support of the healthcare provider, healthcare worker, and the family is very, very important. So I think that should be all from our side. Thank you.
Thank you, ma'am. Thank you so much for your insightful inputs, and especially about the Saheli program, which you mentioned. So thank you, ma'am. So now we move on to our next question. That is the question number 3 to the INC representative from the Indian Nursing Council, Dr. Jyoti Sarin, ma'am. So, ma'am, the question to you is, yes, ma'am. So, what nursing-led interventions make the greatest difference in improving breastfeeding outcomes, particularly exclusive breastfeeding?
Greetings from Indian Nursing Council as well as from Indian Association of Neonatal Nurses. I'm very happy to be there on this platform and to share my views. And I think many of the things have been said by my co-panelists, to which I will not be repeating it again. But most of the co-panelists have emphasized that investing in capacity building of nurses will have a better impact on achieving the targets of exclusive breastfeeding. Maybe, as Dr. Sneha has said just now, that the number of nurses what they have trained, now we have to see what is the impact of that training on exclusive breastfeeding rates. I would like to highlight here is that exclusive breastfeeding, physiology of breastfeeding and the lactation counseling has been an integral part of nursing education curriculum, be it undergraduate program or at a postgraduate program. And all of you must have seen nursing students conducting individual health talks or the group health talks on breastfeeding for the mothers. Now we have to see how can we utilize these strengths in terms of having a better impact. So another concept that is the emergence of neonatal nurse practitioner program and nurse practitioner midwife program, which has been successfully launched in various centers, will also lead to a better impact on the maternal and the neonatal outcome. As I said, that the nurses, what they can do is, they can do individualized lactation counseling, which should be culturally sensitive, should alleviate the myths amongst the community. Then continuous breastfeeding support even after discharge, maybe through telephonic calls, maybe through home visits, telelactation or WhatsApp support group, that is using or integrating technology into breastfeeding counseling. Then, as earlier co-panelists have said, that it is important to have family-centered breastfeeding counseling, where nurses can play a very significant role. Then nurses are at a very right position to upbuild the maternal self-efficacy by reassuring the mother, yes, you can have an exclusive breastfeeding. So reassurance is very important for the mother. And all of us know that whom we are dealing with, the mothers with whom we are dealing, they are Z learners. They are first generation of Z learners, where we need to plan that the counseling should be engaging and immersive. And it should be an experiential learning for them. And all of you, as pediatrician, as neonatologist, as obstetrician, must have known many success stories where nurse as lactation counselor in NICU or nurse as a lactation counselor in lactation management centers have brought the fruitful results. So here, as Dr. Sneha was saying and Dr. Miriam was also saying, that we can prepare a structured educational program which can be conveyed to the different educators, nurse educators who are dealing with this subject, and so that the right message goes to the students. And then they can impart a better community outreach program. Thank you so much.
Yeah, the next question is also for you, ma'am. So in our high, we know all these interventions are useful. So, but how do we strengthen what we know is already useful? So, in a high volume public sector hospital facing nursing shortages, most of the states have shortage of nurses. So, how can all these be achieved? How can you, as a council, get more nurses to join the public sector? And how can this challenge be overcome? And how can the INC, as a council, as a body, how can you work toward this goal?
I think the first priority has to be there. I know there is a huge shortage of nurses. It definitely has an impact. But as Dr. Dilip has said, that emergence of cadre like community health officers, by capacity building of ANMs and ASHAs, we can reach to the target group. But we need to now leverage technology in educating our community, and as well as we need to develop standardized protocols and standardized educational programs so that the same message goes across the country in the same manner. Now, different people might be spreading different messages. What we want a standardized educational program which can be given to the mothers, whether it is at hospital setting or it is at a community setting. Sometimes there may be a difference in the messages which is given in the hospital at the time of discharge and once they go back to their home. So there may be so many culturally sensitive myths may be there, and it may have an influence on mother's efficacy or mother's efficiency to breastfeed the baby appropriately or adequately. So I think we need to work together. As everybody said, we are all stakeholders here. We need to work together, come out with the standardized protocols, come out with the standardized messages, which can be spread in the same manner. Instead of doing individual counseling, we can do the group counseling. We can have two, we can define the timings. Morning, it will be from 11 to 11:30. Evening, it will be from 5:30 to 6 o'clock. So that the messages can be repeated to all the antenatal and the postnatal mothers, and we need to ensure that the antenatal mothers are also ready for breastfeeding. It is throughout the continuum of care which we will have to see what can be done. So my here is take is that standardized protocol, standardized health education messages, leveraging technology to overcome the shortage of nurses. That way we will be able to achieve. Thank you.
Thank you, ma'am. We have a very valuable input from Dr. Armida Fernandez, ma'am. So she says we should also make use of technology. The nurses should also make use of technology to overcome this shortage. So thank you, ma'am. The next question is to the NNF panelist as well as the IAP panelist, Dr. Ruchi Nanavati, ma'am, and NLF panelist, Dr. Lalan Bharti, sir. So the NFHS 6 shows a decline in breastfeeding rates. So what role can neonatologists and the NNF play in reversing this trend and strengthening breastfeeding support in the neonatal period as well as beyond, especially in the premature neonates?
Thank you, Dr. Anita. So this decline is in exclusive breastfeeding reported recently is a wake-up call for all of us, right? Improving breastfeeding rate is essential if we are really very serious about reducing the neonatal mortality rate significantly. As a neonatologist, our responsibility begins immediately after birth. We have already heard all the panelists, and we must ensure the uninterrupted skin-to-skin contact, early initiation of breastfeeding within the first hour of life, support exclusive breastfeeding for 6 months, and provide evidence-based lactational support, particularly for the mother of preterm and sick newborn admitted in an ICU. So every maternity and newborn care unit should have trained healthcare professional, structured lactational counseling, rooming and facility, KMC facilities, and very important, robust post-discharge follow-up. mothers need continuous support throughout their breastfeeding journey, not just the evidence, not just the advice before discharge. So National Neonatology Forum has already taken a significant steps by launching the evidence-based lactational management course, a unique 10-week hybrid program where our Madam Armada Fernandez was the chief guest, and more than 500 doctors and nurses are being trained in this program. And very soon we will be launching the second course, and we are planning to train around 5,000 doctors and nurses in this course. And more importantly, NNF has translated its commitment into the action. Through our accreditation program, breastfeeding indicators have been made mandatory quality criteria for unit to get the accreditation. Moving forward, NNF, together with Indian Academy of Pediatrics, FOXY, TNI, and Government of India must continue to speak one voice. Our goal should be to make breastfeeding quality indicator and integral part of the every newborn care facility, not merely an awareness campaign. So that's from my side.
Yeah.
Yes, sir. So when we are
Yeah.
talking about preterm births,
Just
so
one.
the preterm birth, yes,
So
ma'am,
I
please.
just want to add that basically the neonatologist is very uniquely positioned to influence breastfeeding because he is present during the most critical period, and that is soon after birth, in the first hour after birth, on the first day and the first week of life. And that's how I think that we as a neonatologist can give a good start to a baby in the life and strengthen the future of the child. And our role, rather than looking at us only managing the sick newborns in NICU, we should try to become champions of optimal infant nutrition so that you have not only better growth, but also good neurodevelopment subsequently. So I think our role as a neonatologist and, Dr. Lalan's role as a president of NNF is very, very important. In addition to what he has said, NNF, in addition to building up the workforce capacity, I think what we have to do is that we have to generate the evidence rather than depending on the evidence by the Western country. We should have our own evidence and we should have quality improvement documentation. So, as a professor or in the medical colleges, we should stimulate our students, we should encourage them to conduct the studies on various important such topics like breastfeeding, kangaroo mother care, and generate the evidence and also have the quality improvement documentation. I think that's a need of the day. Thank you.
Yes, ma'am. So ma'am highlighted research and quality improvement, which
That is
are
also
very much crucial. Yes. So, and the next question to both of you is that we are always talking of SNCU or NICU. So, is it time to move towards MNICU? And can NNF IAP work together with the government to scale up or establish more MNICUs at all levels, not just institutes, but at district hospitals and all, even the district hospitals all over the states? So, how can NNF and IAP as a team help in establishment of MNICU in our country?
Yeah, Dr. Lana? Yeah. No, so in fact, the MNICU is the need of the day. And we have a wonderful study done by, from Safdarjung Hospital, where MNCU was started initially, and they have shown the world it was one of the global study, and the center from India was Safdarjung Hospital, and they have showed that how the improvement of the low birth weight babies, survival is increased significantly with MNICU. Now, over last few years, the MNICU is happening in the other parts of the country, but I think rather than having only SNCU that was initially, now it's a need of the day that we have MNICU, which is there, and that concept should be there, and government has to do it, and of course we as the pediatric bodies, we have to do that. In addition to that, we have to have, there are regional disparities between the state and the districts, and that one has to look at to promote breastfeeding and to reduce neonatal mortality rate. Then there is also inconsistent implementation of evidence-based practices. We actually talk one thing, but in practice that particular thing is not done, which all of us are very well aware of. So we have to concentrate on that and see that whatever we believe is put into the practice. And people have already spoken about workforce shortage and uneven training. Now training is not uniform throughout the country. You have nurse who is trained in say APNC, and after 2 months she is transferred to some orthopedic ward. So that requires, also needs to be changed to have the proper training and reducing the thing. And whatever the gaps we have seen are this thing, so the coverage all over the thing, increasing the institutional deliveries, everything, the coverage has improved faster, but the quality and continuation of care has not improved. And I think the first step in that is to have MNCU, that is Mother Newborn Care Unit, and it's a need of the day. And I can tell you, even in the metro cities, you will hardly find MNICU present. So I think that's a need of the day, and very nice that you brought up this point. Thank you.
So thank you, ma'am, for highlighting EBM. So evidence-based medicine is very important for EBM as well, which is express breast milk for the preterms. So we need to strengthen already the existing evidence-based practices. The next question is also for both of you, ma'am. India has set ambitious targets under the INAP and the SDG, that is the Sustainable Development Goals, for reducing the neonatal and the child mortality. So where do we stand today, and what gaps remain? And how can we achieve these targets when our exclusive breastfeeding rates are falling? Can we have the next slide on the targets and the present mortality rates? Yes, ma'am. And sir?
So, So, India has made remarkable progress in reducing the neonatal mortality as well as the child mortality over past few decades. However, we are still far from where we need to be. So, our current NMR, as you is around 17 per thousand live birth, whereas the INAP aims single-digit IMR by 2030. So achieving this ambitious target, we need to accelerate our effort, and we need to collaborate better with all the stakeholders. And also, as Dr. Nanavati was telling, there are very wide variations. So we need to have a state-specific strategy based on the local need. And we should focus on the low-cost, high-impact intervention such as breastfeeding, KMC. You were talking about IKMC, and then effective neonatal resuscitation, infection prevention, family-centered care. Then exclusive breastfeeding, it remains one of the most cost-effective intervention available. And it significantly reduces neonatal infection, pneumonia, and everything. And also the long-term health and neurodevelopment. So the challenges today is not the absence of policy and evidences. So it is the gap between the policy and its implementation. We need a universal early initiation of breastfeeding policy, a skilled lactational support, protection from the, very important, protection from the inappropriate marketing of breast milk substitute, and continuity of the care after discharge. That is also very important. And the stronger integration of the maternal and newborn service, as we were discussing about the MNCU. That is very important. That is upcoming, and we must advocate for this not only in the government setup, but in the private setup also, because there is a set protocol for MNCU in the government setup, and now the newer SNCU are being constructed along with this MNCU. So if every health facility consistently deliver quality newborn care alongside this breastfeeding support, KMC, family center care. So definitely India can achieve both this INF goal as well as the this STG targets. So we need to work simultaneously. All organizations had to come together.
Yes, sir. So thank you, sir, and ma'am, for your insightful inputs on how improving exclusive breastfeeding and following or strengthening evidence-based practices will help us to achieve our single-digit neonatal mortality goal. Hopefully, it will happen, and hopefully, we will achieve this target by this joint alliance. So thank you, sir and ma'am. The next question. Okay, this question is again to the IAP NNF panelists. So we have a lot of national programs, the MA, the Lakshya, Muskan, the Home-Based Newborn Care, HBYC, ASHA-led, so many national initiatives. They have established a strong framework for newborn care. But what are the ground realities of implementation? And is it time to adopt common breastfeeding quality indicators across both private as well as public sectors?
So my answer is an equivocal yes. This should be there, right? So there is a simple principle in quality improvement. What you get measured gets improved. So if truly wants to improve the breastfeeding outcome across the country, we need to have a uniform set of breastfeeding quality indicators applicable both public as well as the private healthcare institution. And these indicators should include like breastfeeding initiated within the first hour of the birth, then exclusive breastfeeding at discharge, and availability of the trained lactational support, compliance with the baby-friendly hospital, KMC care for all eligible newborns. Still, KMC care is, I don't think this is more than 40%. So a structured breastfeeding follow-up, that is very important, a structured breastfeeding follow-up after the discharge. So the objective should never be inspection of the institution alone. The purpose is to continuous quality improvement, benchmarking, learning from the best practices, and ultimately improving the outcomes for every mothers and newborn. NNF has a robust and well-established accreditation program, and breastfeeding quality indicator is an integral part of this process. So working together with IAP, FOXY, TNI, and Government of India, we can further develop national benchmark and encourage periodic audit, and we can recognize the institution that demonstrate excellence. So when every hospital measures the same indicators and continuously improve upon them, I think breastfeeding promotion will evolve from being merely a public health message into a measurable quality outcome.
Thank you, sir. Dr. Ruchi, ma'am, do you have anything to add?
Yeah, I just want to add that, the question today is not that do we have the policies, but the question is, are we implementing them consistently, and are we measuring the outcome or what matters? That is more important. Now, if we say we advise on breastfeeding, that the breastfeeding is the best, but how many of us actually stand next to the mother, look at the breastfeeding technique, assess whether the latching is effective, and provide hands-on support before discharge to a mother. And everyone can look at, honestly at their own answer. We just say give breastfeeding, but very, very few people are actually seeing what is happening to this mother subsequently. And when you look at the indicators, that quality indicators should actually reflect the meaningful outcomes. And that's why, I have just noted down few that at birth, we should see whether the breastfeeding is initiated in first 1 hour, whether there is immediate uninterrupted skin to skin contact, and its duration. Not only the baby is kept on the chest for some time and taken out, it should be at least there for 1 hour, because breast crawl can require 1 hour. Many times it happens that the baby is kept on the chest and the baby is taken. But the healthcare person, either doctor or a sister, has to be by the side of the mother till there, be present there till the actually breast crawl occurs, which can take up to 1 hour. Before discharge, effective latch has to be documented, and exclusive human milk feeding at discharge for eligible infants. Many times in NICU, we have to document that. Mothers of NICU babies should be supported to express milk within 6 hours of their baby is born. So most of the times this doesn't happen in NICU. After discharge, you can see how many babies are exclusively breastfed at 6 weeks, at 3 months, and at 6 months. So that will give you an idea, that we know that many times in certain hospitals, the first 48 hours also the babies are given little bit of formula. So here, exclusive breastfeeding, you have to see that what is happening at 6 weeks, 3 months, 6 months. And you look at what are the readmissions related to the feeding problems. Whether it is because of feeding problem, whether baby is admitted with dehydration with high sodium. All of us have seen why this has happened, because the mother has not been able to feed properly, whatever is the reason, or whether there is excessive weight loss. So these are the indicators. And for neonatal units, for NICU, SNCUs, we should see whether donor human milk bank is available. You are managing 800 grammars and 1000 grammars, you don't have human milk bank. How do you manage them? Then you look at the time when the mothers are LSCs. When do they first, or otherwise also, when do they first express the milk? The baby is in NICU when the milk is expressed. Kangaroo mother care coverage is still very, very less. And we as a kangaroo mother care promoters, this actually hurts us. And Dr. Udani is there in the, in this program. And so kangaroo mother care coverage has to increase extensively. Right. And human milk feeding at NICU discharge, we should be seeing. And if we do this, that we will do a good job for the babies. Thank you.
Yeah, thank you, ma'am and sir. So we have an input coming from Dr. Rekha Udani, ma'am, that in their follow-up group, they have more than 95% of exclusive breastfeeding at discharge. That is, even after NICU discharge, if good KMC is done. So we have ma'am giving that point. So yes, we need to stick to evidence-based practices like KMC to improve exclusive breastfeeding. And like you said mentioned about breast crawl. So a lot of us or a lot of students might not be aware. So we have another very important input coming from our ex-HOE, that is Dr. Sahana Devdas, ma'am. She has highlighted about the 9 instinctive stages that can happen on the mother's abdomen. So this has to be pushed into the curriculum, the nursing curriculum, the undergraduate, as well as the postgraduate curriculum. So thank you, panelists, for these inputs. And also thank you, the members who have put their points in the chat box. My next question is to all the panelists out there. Before that, let's look at this one slide to just sum up the NFHS 6 statistics. So can we please have the next slide, please? Yes. So I've just taken this example. You can see in the slide, our institutional births. I hope the slide you are able to see. Yeah. Please put the next slide.
To share the screen.
Please share. So there's too much of focus on institutions. We have the institutional births itself, which are more than 90%. So if we look at India's statistics here, we have more than 90% institutional births, and 85% of them had newborn postnatal care within 48 hours. So everything happened well in the institute. But then what happened in the community? Our exclusive breastfeeding fell to less than about 60%. So it is 55%. So see the decline here. And there's a lot of focus on institutions. But what is happening at the community? So where is the missing link? So even for example, like, even in our state, that is, I come from Karnataka. So in our state and in our hospital, this is a public sector hospital, Vanivilas Hospital. So if we look at this, our hospital has, our state has about more than 98% of institutional births. And we have good postnatal care as well. And if you look at our own hospital data of the number of babies, that the percentage of babies who are getting exclusive, exclusive breastfeeding or only breast milk or DHM, that is donor human milk. Fortunately, we have a milk bank. So it is 100%. This is our key performance indicators in the Muskan. So this is very impressive because we have a milk bank. So in the institution, we feel like, okay, we are doing good. We can pat our backs. But what is actually happening in the community? So where is the missing link? So my next question is to all the panelists, what is actually happening in the community? So we seem to be doing an okay job at the level of the institutions. To what extent are all these mothers getting influenced in the communities? So we have reels, mom influencers, digital marketing. So to what extent are all these shaping the feeding decisions of today's Gen Z moms? So if social media is a big problem, so how do we make it a part of the solution? So I actually got all these on Instagram. So these are all personal experiences, but these mothers also have public profiles, and then they ask for followers, and a lot of moms can get influenced by these, and they also have this baby was preterm and it's 90% formula fed, and what are the techniques, good proper feeding, bottle feeding, and not to how not to shame a mother who is bottle feeding. See, that can be a personal experience, but putting it as a public profile can really affect moms coming from the lower socioeconomic status. And then I also saw so many that, they gave formula and then the baby is able to lift heavy weights at 1 year. So what formula did to their infant? So the infant became strong and big at 1 year. And so here also there are twins. So moms can actually look at all these and get influenced. So how much of misinformation is spreading and who is actually tackling all this? So the next slide, please. Yeah,
I
so
think
before we move to the
there
questions, I also have the next slide here. It's not just exclusive breastfeeding and bottle feeding. Also, we have a lot of mom influencers who promote early introduction of complementary feeding. I was shocked to see 4-month baby getting rice water, and these are all saying follow for more recipes, follow all of these. And many of them also say my pediatrician recommended all this. So they're even dragging their doctors into this. So I have this question to all the panelists. Is this a real problem? The mothers 5 years back probably were not exposed to this much of social media content. So can this explain why our exclusive breastfeeding percentage is falling?
I think, Dr. Anita, when we talk about this, we have two extremes of you have challenges at the two extremes. On one side, you have the older generation forcing unnecessary the formula feed and even the additional food what they advise at their domestic level, and at the other end you have this social media where they are promoting the wrong messages they are giving for the early supplementation or the complementary feeding. When you're talking about the formula feed, I do have a comment here that yes, as a neonatologist, we do have the responsibility not to promote and not to prescribe the formula feed or any infant milk substitute for that matter, because whatever said and done, we cannot deny that this is the reality. And definitely there is a promotion and prescription for the infant milk substitute. I think this needs to be sorted out at the national level or maybe at the grassroots level. So the one side you have the myths saying that the milk is not adequate. That is one. Secondly, the colostrum is not healthy. You need to discard the initial feeds. All these are the myths which you have to actually clarify to support the early initiation and the exclusive breast milk supplement, it's a breastfeeding. And the other side, as I said, the social media, definitely you need to go in a scientific way. There was a question for me actually, which we skipped, I suppose, whether Laksha Manyata and Laksha, or, the question was Laksha Manyata or NABH accreditation and any such, the institutional level certification, whether that will help. When I talked about the first question, I had just said there should be certain labor room protocols and certain recommendations by WHO, UNICEF, and BFHI to be followed. So, when we talk about Laksha Manyata, definitely the Laksha, as government of Maharashtra has taken up Laksha and Manyata even for the private hospitals, and Manyata is by the Foxy initiative. It gives you all the recommendations to be followed. So we have we talk about the respect of the mother, and of course the informed choice, informed decision making. So definitely when you are better informed, you have better informed choice. And when you have the information in, you have the support also, whenever the staff is so supportive. So informed decision making, informed choice, and of course support from the healthcare providers and healthcare workers, that definitely promotes you, or helps you in continuing the whatever practices we are talking about, the early initiation and the exclusive breastfeeding. I think that should be from our obstetrics point of view.
Yes. Thank you, ma'am. What about the other panelists? Could IEP, NNF, POGZ, and other government platforms become trusted sources that every mother or every new mother is encouraged to follow, because social media is powerful? So can mothers become evidence-based digital ambassadors, and can we have like NNF or the IAP official platforms where all such reels which are evidence-based, fact-checked by pediatricians, can we have this so that new mothers get encouraged to follow evidence-based breastfeeding practices?
Yeah, as I would like to put some comments that when we are talking about these Gen Z mothers, they want an instant access to the answers at any time. Suppose if the mother has problem with her this thing at 2 a.m. in the morning, she's more likely to watch something on the social media and take their advice, because they also have relatable stories from mothers with the similar experience. They have visual demonstration, and that's what this new generation wants. And when the social media gaps gets sort of intensified, when mothers receive inadequate antenatal counseling, limited breastfeeding support, early discharge, and little follow-up. So we as an institutions, IAP, NNF, what we have to see that we have healthcare organization should create a short evidence-based reels rather than created by some influencer. We can do it scientifically, the short evidence-based reels. We can have 1 minute myth busting videos. So you are telling them what is wrong. Build the trusted digital voice because it's from a doctor, and create positive digital communities and teach them what is called a digital health literacy. So what do we mean by that? That when I'm watching something on a YouTube, I should be checking that who created this, what is an evidence, and does it have a reference from a health organization or any health body. So when our mothers know about this, probably they will have a better follow, they will understand what are they going to look at, and that will sort of change the practice over the years. And then of course you have the suppose if we just imagine that we have a national campaign where every new mother receives, say, a QR code making an evidence-based breastfeeding videos. That is something what the new generation wants. Access to the verified digital resources. Hospital created educational reels. Now suppose if there is a reel on KMC by KM Hospital, which we are the pioneers in KMC, it will have a great value. You have a follow-up support to the tele-lactation services and consistent messaging from pregnancy right up to the infancy from a healthcare bodies, and I think that will be great and will be have a positive reinforcement for breastfeeding. Thank you.
Thank you, ma'am. So
So,
this calls for a need
so I-
for digital platforms from all these professional bodies to be so that our mothers get access to evidence-based information. Sir, do you have anything to add?
So I do agree with Professor Nanavati that there should be some evidence-based reel, short reel for on the website of the professional organization and speaking the same language, right? And NNF is working on that. Number one. Number two, we must focus more on the communication and counseling of the pregnant ladies right from antenatal care. As our chief guest was speaking, so we should focus right from the uh, adolescent period regarding the breastfeeding, all these issues. I think that will solve all these issues.
Yes, and also another question that I had. What about these mob influencers? Who are regulating them? And they're also showing the formulas and they're even showing the brands. So is there a need for IMS Act as well? I'm sure IMS Act itself is a separate,
There is, yes.
yeah. So since we're discussing about social media, so do you think that there is a need for some regulation from all these bodies that this is wrong, so then we remove this misinformation? So there has to be some regulation. So we can't have public platforms no sharing misinformation or misguiding moms.
So professional organization like IAP and NNF can give the advisory to the members. NNF keeps on sending the advisory on this IMS Act, and we can send, but we don't have the control over the this drugs company, and that the government can take care of that. But the professional organization can only send the advisory to the member, and NNF can keep on sending this advisory as far as the IMS Act is concerned.
Yes. Thank you, sir. Thank you for that. And we will move to the final question. This is again for all panelists. So every time we hear, central government, we have some Sukanya Samriddhi, and then we have a lot of state governments having incentives. So is it time to explore innovative incentives for exclusive? So we are having incentives for so many things, for travel and bus and so many things. But is it time that we also look at some incentives for a mother who is exclusively breastfeeding for 6 months? It could be cash based. So what is your take on this?
So again, for that, we need to have a stronger data and indicators. First, we have to work on the indicators, then only we can vouch for or advocate for this initiative. Very good thought on that. But again, for that, we need to have a strong data, and then only professional organization can move to the government for such type of initiative.
Yeah, what I feel is, that the objective here should be to remove the barriers and not simply reward an outcome if a particular mother does. So you can give it in a different way. We can have extended paid maternity benefits, especially the women in an informal sector where they don't get advantage. We can give that. They should have free access to the lactation consultation, and in fact, if available, even teleconsultation also, and the childcare support and the workplace accommodation for breastfeeding mothers is a need of an hour, because you go for work and your children are at home and your heart is at home, and you are working. So sometimes even your work output is not very satisfactory. So that's what we require. And as we are already in the process, together the organizations can have national breastfeeding collaborative with standard goals and accountability. And I think that's a need of the day, and it's actually done with a shared vision for breastfeeding. All the organizations talking the same thing, same shared vision is what is the need of the day. Thank you.
One final question. Should we move away from hospital certification to introduce breastfeeding friendly certification for workplaces? Dr. Armida ma'am already brought about this. Will a laborer really get 6 months leave? So should we actually certify, or should professional bodies look at certifying workplaces for breastfeeding friendly certification, and not just hospitals to support working mothers? Yes. Can I have the panelists to answer this last question?
No. Actually, for these workplaces, for we can have the areas for collaboration, and in that we can have sort of develop breastfeeding recommendations so that the mother receives. There is a one national message. One can have a shared training, which is create multidisciplinary training programs, and they happen, and you can have common quality indicators and joint advocacy. So we are, as we have already said, that breastfeeding, it should not be viewed solely as a nutrition intervention, but it should be looked as health, developmental, and a sort of economic investment, so that your future generation is better. You can have digital engagement, you can have research and quality improvement, and all this will help for the promoting breastfeeding in the in our country. And that's what my opinion about promotion of breastfeeding at this stage.
Yes, ma'am. So that's about collaboration and also public-private partnership, which will take a long
Yes.
way in improving breastfeeding rates. So we come to the end of the panel discussion. I would request any of the panelists to summarize, or I would also do it if not. So can we just have a summary of the points that we discussed in today's panel? So would you want to just put everything in one single summary? Or even ma'am, or the panelists from Foxy, anyone. I invite anybody to just summarize today's panel discussion.
I think, Anita, you can do it.
Yeah. So what we've discussed is we need to strengthen the existing evidence-based practices, starting from antenatal care. So where skin-to-skin contact is important, early initiation of breastfeeding, and continue. So we need to support continuum of care. We need to move from SNCUs, NICUs to MNICUs, improve kangaroo mother care, and of course support mothers not just in the hospitals but also in the community. Yes, and also in the working places they need. And also we also need the social media. We need to use the power of social media to influence the mothers with proper evidence-based medicine. So I think these are some of the points of from today's panel discussion. So the final take-home messages are that, can we have the slide, please? The decline in exclusive breastfeeding in the NFHS 6 is a national wake-up call. So let us pledge today that when NFHS 7 is published, India will hopefully celebrate its highest ever exclusive breastfeeding rates, because every child deserves a sustainable start in life. And in this age of artificial intelligence, let's protect and nurture natural intelligence with sustainable starts through exclusive breastfeeding. So happy World Breastfeeding Week. Thank you one and all for joining, and happy Independence Day in advance. Jai Hind. Please, can I have the slides? Thank you. My sincere acknowledgements to Dr. Armida Fernandez, ma'am, for being the chief guest for today's panel discussion. I thank Dr. Asha Benkappa, ma'am, for bringing me to this panel and putting me alongside such big stalwarts, which I was initially not mentally prepared to. And also, Asha, ma'am, thank you for planning the whole World Breastfeeding Week, all the topics. Thank you, Neelam Mohan, ma'am. So me being a part of this panel along with you and also Dr. Ruchira, ma'am, is a great blessing for me. Thank you, Ganesh Kulkarni, sir, for coordinating this. I sincerely thank all the panelists of today, Dr. Ruchi Nanavati, ma'am, Dr. Lalan Bharti, sir, Dr. Sneha Buyar, ma'am, Dr. Jyoti Sarin, ma'am. So discussing with you all was a wake-up call, was an eye-opener. Thank you so much for all the points. I finally thank my HOD, Dr. C.N. Reddy sir as well. So thank you one and all.
Thank you. Thank you very much.
Yeah, thank you, Anita. Thank you for everything.
Thank you. Thank you.
This program wouldn't end without the contribution and the leadership of Dr. Alok Bandari sir, who is our treasurer, national treasurer, and he has always been very instrumental and phenomenal, backing us to do all these programs. So I request Dr. Alok Da to please convey the vote of thanks today.
Well, good evening, friends. It's been a great day, great long marathon session on a topic which breastfeeding has been inherent in Indian mindset since time immemorial. But with modernization coming up and the modern lifestyles getting, breastfeeding was getting a toll. And even the recent NFHS survey also gives alarming figures. But then our session today will definitely take us towards promoting breastfeeding, supporting breastfeeding, and that is all that is required today. And even as Secretary General NNF, and I have been, and as IAP Treasurer and Joint Secretary, I have interacted with most of the leading lights that grace the platform today, and I'm thankful to one and all, especially VN of our visionary President Dr. Neelam Mohan and our Secretary General Dr. Ruchira, who conceived this, bringing the leading lights from NNF, IAP, FOXY, and Nursing Council together. And definitely we shall be able to promote, support breastfeeding. Thank you, one and all. Thank you.
Thank you.
Thank you. Thank you.